This is Dr. John Whitcomb from Brookfield Longevity, Brookfield, Wisconsin, telling this week's story about iodine deficiency and mental retardation. We have a remarkable new study published just this week in the Journal of Clinical Endocrinology and Metabolism by Dr. Kristen Hines from the University of Tasmania. That's a compelling story to tell. She took 220 women who were pregnant and looked at their urinary excretion of iodine. Now, we know that iodine deficiency is a big problem around the world. The World Health Organization says that iodine deficiency is the #1 cause of severe mental retardation, and about 1 billion people, maybe as much as 40% of the world even, live in parts of the world with very inadequate iodine intake. We also know that in Milwaukee, Wisconsin, where I live, as many as 50% of the women 100 years ago in our city had mild goiter, which is an enlarged thyroid gland that comes from iodine deficiency. And that was cured by putting iodine in our salt 100 years ago. So the average American intake of iodine is roughly 200 micrograms a day right now, which is pretty good, but it's declined about 30-40% in the last 20 years as we've avoided eating salt and we've all started eating sea salt, which has much less iodine in it. What Dr. Hines did in her study was look at the urinary excretion of iodine, and below 150 micrograms a day means you're pretty deficient, but not severely. That's mild deficiency. She then followed those children for an average of 9 years and followed them to see what their results were down the road. And what she found was startling. In the kids whose mothers, who had a urinary excretion of iodine that was less than 150, their spelling went from an average score in Australia of 412 down to 371. For grammar, the average Australian child had a score of 408 and went down to 377. That just means those kids whose moms had mild iodine deficiency had a statistically significant reduction in their mental capacity to do standard schoolwork. That's a problem. Every one of us wants our child to have every opportunity we possibly can. Our future depends on our kids having proper and adequate nutrition. What will work for me? To me, this is a crisis. We want every child we know to have adequate nutrition pre-birth, and it seems like that iodine adding after birth doesn't help. That ship has sailed. It's critical that the pregnant mother gets adequate iodine. Our current recommendations, you get 150 micrograms a day and 220 if you're pregnant, 280 if you're breastfeeding. I think that should even be raised to, that's a minimum. That could be raised to 500 micrograms a day. I'm certainly going to do that for all of my customers. I've been measuring iodine, and I'm being surprising how many people are low. And for what should you do if you're not pregnant? I think we should all be on a little extra iodine. I think under 1 milligram a day has been found to be perfectly safe for everybody unless you have thyroid disease. It's something worthwhile talking about with your doctor. If you want to talk to me, I'm at Brookfield Longevity in Brookfield, Wisconsin. Nice talking to you.